Biomedical ethics. Before diving into the ethical concerns regarding this topic, let's first discuss the origination of the allopathic medication versus the natural medication, and let's see where this takes us. Initially, medicine was diverse, with doctors practicing chiropractic, naturopathy, homeopathy, holistic medicine, herbal treatments. Medical colleges and physicians focused on holistic healing and an herbalist approach. John D Rockefeller, one of the wealthiest individuals in history, built a vast empire by controlling 90% of the US oil refineries through Standard Oil by the early 20th century. As scientists discovered petrochemicals, oil-based compounds with applications like plastics, Rockefeller recognized an even greater opportunity in pharmaceuticals. When vitamin C was first artificially synthesized in Switzerland, he saw potential to develop medications from petroleum, leading to patented drugs and immense profits. His strategic approach allowed him to dominate the petroleum, chemical, and medical industries, transforming Western medicine into a highly lucrative business. Leveraging his immense wealth, Rockefeller acquired a stake in a very influential German pharmaceutical company, and that marked the beginning of Rockefeller's influence on the medical industry globally, till today. The rise of the allopathic medicine. Petroleum-based medicine became the dominant approach, despite its crude methods at the time, such as bloodletting, invasive surgeries, and the use of toxic heavy metals like lead and mercury to supposedly cure diseases. Allopathic treatments often focus on symptom management rather than addressing the root cause, leading to prolonged medication use assisted with severe side effects, which then require more medication. It's an ongoing loop. The reliance on synthetic drugs also disrupts the natural bodily functions, affecting gut health and overall well-being. Rockefeller funded medical schools only under the condition that they exclusively taught allopathic medication and treatments. As a result, the natural healing methods, herbalist, and dietary approach were systematically removed from the medical curricula. To cement his monopoly, Rockefeller launched a media-driven smear campaign against homeopathy and natural healing. These practices were discredited, and the doctors were imprisoned for using these traditional treatments and cures, which actually were effective for decades. Soon, all medical colleges followed a standardized allopathic model, where prescribing patented drugs became the norm. Today, large pharmaceutical companies fund these medical colleges to ensure their patented drugs remain central to medical education. Alternative treatments are often criminalized, such as the legal restriction that cancer can only be treated with chemotherapy, surgery, or radiation. Given the high cost of cancer treatment, Rockefeller's influence ensured the industry remained highly profitable.
Everything I've seen in all the autopsies I've done of cancer patients, not one of them died of cancer. They died of liver failure, they died of cardiac failure, renal failure, all due to chemotherapy. We got a patient that had been through chemo and radiation, and they had cooked her liver and cooked her kidneys. We looked at the blood work and realized she had no organ function to speak of left. And I said, we can make her more comfortable, but the radiation treatment that they used on her has actually destroyed her organs. So we did what we could. She'd been given 3 weeks, we gave her 6 months. And she got time to say goodbye to her family. But I remember walking into the office the morning after she passed, and this internist was sitting on the waiting room couch. And I said, what's the problem? And she looked at me and she said, I'm doing the death certificate and I don't know what to write for cause of death. I said, you might try writing the truth for a change. And she said, you know how much trouble I can get in by doing that? I said, if you're going to study with me, you're going to write the truth. And she wrote radiation poisoning, cause of death. She's the only doctor I've ever seen do that. She actually had the courage to tell the truth.
By the way, Rockefeller founded the American Cancer Society in 1913. A pill for an ill became the mindset of American medicine, and the world caught on to it. Knowing how unethical and toxic this petroleum-based medication, allopathic medication, is it not better to study and embrace the herbalist approach, the holistic approach, and the natural healing? Study people like Barbara O'Neill and others who have unlocked the secrets of natural healing. Psychiatric ethics is a crucial aspect of biomedical ethics, focusing on the moral principles of mental health care. Modern-day pseudopsychiatrists and their teachings have destroyed mankind worldwide. They're fully indoctrinated by the teachings of Freud and Darwin, continuing eugenics, hence purifying human species through ethnic cleansing, and to eliminate mental patients as a continuation of eugenics and unscientific methodologies. Pseudopsychiatrists manipulate, disfigure, rape, and destroy anyone they like, turning their asylums into torture cells, silently killing them on drugs, making them suicidal, while amassing trillions of taxpayers. They view their patients as subhumans, not having completed their evolution, therefore not deserving to live or be treated as equals, thus abusing them financially, mentally, physically, or sexually was deemed fine. The Citizen Commission on Human Rights President Jan Eastgate called psychiatry the industry of death. Let's see what she had to say about this. Since the early days, when psychiatrists chained, fogged, starved, or tortured their patients into total submission, little has changed. Then, as now, the goal was subjugation of the individual, not to cure madness. The brutal treatments psychiatry evolved and still used to this day, electric shock therapy, psychosurgery, and debilitating drugs, stand testament to the fact after psychiatry moved beyond its asylum walls and into society came the truly disastrous results. In today's psychiatry, motivated by its mission to follow the money. You're witnessing a profit-driven, corrupt industry that leaves death and destruction in its wake.
How many people have I cured? Well, there are no real cures right now in psychiatry.
Yeah. The idea of you asked me about the issue about how many people I've cured. I don't know that any of us are ever completely cured of anything.
I have not been able to cure many patients.
I have cured none of my patients.
Now that we have established how unethical and cruel these pseudopsychiatric treatments and procedures are, we can discover EGM, El-Gilani methodology. As states, a methodology scientifically demonstrated for the first time in the world in healing patients suffering from incurable mental and physical diseases. Before a panel of researchers from 8 countries in Psychiatric Research Institute at Taif, Saudi Arabia, between 1976 to 77. EGM is currently being practiced on a clinical level in the USA and other countries today. EGM focuses on healing the soul through Quranic therapy, a holistic approach, and natural approach. It has been demonstrated under the auspices of the World Health Organization, making them realize that pseudopsychiatry, modern psychiatry, is nothing but a big scam and a money-making agenda. Dr. Mubarak Gilani, who formulated the Quranic therapy, EGM, states, Sufis know the causes of mental illnesses and have been healing very successfully for centuries. People with mental illnesses are suffering because of diseased souls, not due to chemical imbalances, which these pseudopsychiatrists assert. They call themselves psychiatrists or scientists of the soul, yet they deny the very existence of the soul. Thank you very much.